The next document is the informed consent document. So informed consent document, first of all, it is a process of discussion between you and your healthcare professional called informed consent, frequently results in agreement and authorization of care, treatment or services before surgeries and treatment. The patient has the right to information and inquiries. Adult patients who are mentally competent to consent the treatment must do so before treatment can start. Now, informed consent document, actually it is an informed consent process, and it is a process which happens between the participant and the healthcare professional, and healthcare professional is generally the investigator or the CRC. CRC is a clinical research coordinator, which is the coordinator for the clinical trial process. Okay, so now in that process, what happens? All the details will be shared related to the clinical trial process with the participant. If they have any queries, they can ask. Okay, and in case if they have any queries, they can ask. If they do not understand anything, they can ask. They can take the informed consent form along with them. They can discuss with their friends and family, and then after that they can come and they can tell their decision that whether they want to participate in the clinical trial process or not. Okay, in case if they decide, like in case if they have agreed to participate in the clinical trial process initially, but when actually the clinical trial process starts, then they feel like that now they do not want to continue the procedure, whatever the reason is, so they can withdraw their consent at any time. Okay, in that case, they can withdraw their consent at any time with or without telling any reason. Otherwise, there is a proper procedure. If they want, they can follow it. It is always recommended to follow a procedure. If they want to withdraw their consent, they are free to withdraw their consent at any time during the clinical trial process. Okay, and then after that, which will not lead to any kind of penalty to them. They will not be charged any kind of penalty, or otherwise their medical rights will not be obliged. Okay, so will not be provocated. So that is completely the decision of the participant initially also, and then afterwards also, that whether they want to decide that whether they want to participate in the clinical trial process or not. In case if they have decided initially that they want to participate, but maybe after some time they feel like that they do not want to continue their participation, that they can withdraw at any time of the process. Okay, in between the process. The informed consent procedure ensures that before you make a decision, your healthcare professional has informed you about your illness as well as testing and treatment alternatives. So there is a set of inclusion criteria and exclusion criteria which is decided. So according to that, only the participants are recruited. If they are falling in the inclusion criteria, then only they will be recruited. In case if any of the exclusion criteria, like if in exclusion criteria it is mentioned that pregnant women are not allowed, and if the female is pregnant, then in that case she will not be allowed to participate in the clinical trial process. Okay, and during the clinical trial process also, it is a responsibility of the participant that they should tell the healthcare professional or the investigator about their illness, as well as what are the treatment and testings which are done, what are the treatment, if the participant is taken any treatment beforehand, about the treatment also, that will help them to decide that whether you are eligible. Like suppose sometimes the condition is very severe, so in the severe condition, the participants, if it is not required, then they will not included in the participant in the study. Only the participants, those who have the acute condition, they are only included because it is a testing procedure. So that's why this precaution is taken. And the participants, those who are mentally stable, they are mentally competent, they can give their consent on their own. In case if the participant, in case they are pediatric population, in case if the participant is unconscious, they are in coma, or they are not mentally stable, but the study requires the participation of such patients. So in that case, their LAR is legally authorized representative. Legally authorized representative can be in direct relationship with the participant mother, father, husband, wife, brother, sister, or maybe the guardian or any legal representative. So they can give the consent on behalf of them. Okay. So information includes like information which you should, which the participant should tell to the, or the information which is included in the informed consent form, that is the name of your condition. What is the name of your condition? Name of the procedure of or the treatment and the healthcare provider recommends, what are the risks and benefits which are involved with the treatment or procedure, risk and benefits of other options, including like not taking the treatment or procedures in case if there is any condition. So that all information should be provided in the informed consent form. So informed consent form is actually, it is divided into two sections. First, the patient information sheet. So in patient information sheet, all the information is provided related to the risk and benefit and how the procedures will be conducted, what is the financial compensation which will be provided to them in case if they suffer from any kind of injury or any kind of serious adverse effect, life threatening adverse effect, or in case they die, so what is the financial compensation which will be provided to their nominee. Then in case if they suffer from any adverse event, full medical management will be provided to them. And then what is the remuneration which will be provided to them in case if they decide to participate in the study. If when they participate into the study, if any additional cost which they have to bear, like traveling cost or loss to wages, so that is also provided. And what is the procedure, what are the risks which are involved, and what is the procedures which will be followed, how many participants are there in the study, then how they can withdraw at any time, but there is a proper procedure which is to be followed. So if they want to withdraw the consent, they should properly inform their investigator, and if any follow-up is required, so they will be available for the follow-up also. What are their responsibilities? So all that information is given in the patient information sheet. Then there is a informed consent form, which is a kind of a form in where all the details about the patient is filled, and they will sign of the investigators will be done. They also have to sign the form, and then they will submit the form to the investigator, and the copy of that form will be handed over to the participant for their reference also. Okay, so this is what informed consent form is. Informed consent document is, we actually call it as a ICD, that is informed consent document. Okay, so and then what is the procedure which is followed? So your healthcare professional has signing a form of informed consent is, first they'll provide you that what is a clinical trial process, what does it involve, what is the objective, why this clinical trial process is being conducted, why you have chosen, you have been approached, not chosen, but approached to participate in this clinical trial process, or you have been asked to participate in this clinical trial process. Then after that, what are the procedures which will be done, what are the treatment options which are available, like if it is like this is a drug, it will have this type of effect on you, and in case if they suffer from any adverse effect, what will be the best medical management which will be provided to them by the investigator. So that all information will be communicated to the participant. Okay, then you have had a chance to ask questions that and are aware of the information. So you'll have a chance that you can ask the questions, whatever doubt the participant is having, they can ask their doubt again. If at that point they do not have any doubt, but they want to take some time to discuss it with their friends and family, then they can take the consent form with them, and then they can discuss it with their friends and family. So that so in case if afterwards they'll go through it again in detail, and if afterwards they'll come across any doubt, then after that also they can ask. Then using this knowledge, you can choose whether you wish to go through with the suggested treatment option that have been described to you. You may occasionally decide to take any portion of the necessary care. Your option should be discussed with your healthcare provider. So now with all the information which is provided to the participant, they can decide that whether they want to participate in the process or not. Okay, and you may if it is possible, the participant can also discuss with the healthcare provider or with the investigator that in a particular section of care, whether it is possible for them that they can decide in a particular section only, otherwise, and then after that they will discontinue. If that is the option available, then they can decide accordingly. If it is that option is not available, if the investigator says that no, that option is not available, if you are participating, then you have to continue your participation for all the processes which are involved in the clinical trial process. So then accordingly, so majorly means that overall means that whatever information which is shared with you and asking all the questions, the participant clearing all the doubts, they can decide that whether they want to participate in the clinical trial process or not. And by signing a consent form, you indicate your agreement to receive all or any of the treatment options. The paperwork must be filed out and designed in order for your doctor to proceed with the treatment plan. So now when the participant, they have decided that yes, they are interested to take part in the clinical trial process, then they have to sign the consent form. And by signing the consent form, it indicates that they are by signing the informed consent form, it is indicated that they are agreeing to participate in the clinical trial process voluntarily. Nobody is forcing them, nobody is pressurizing them. Whenever they want, they can withdraw their consent without any penalty on them, or without any penalty, or without their medical rights being affected. Okay, and then after that, when they are participated and when actually the clinical study will be started, so they will be notified. Then at that time they have to visit to the clinic or to the site. Then the doctor will start, or the investigator will start with the treatment, whatever the treatment is to be done. Okay.